Hi, so I'm at the hospital, I'm in the chemotherapy suite and I'm here for my first infusion of GemCarbo, which is Gemcitabine and Carboplatin, and I've got my label and I've put my special cream on my chest, which will hopefully numb the skin so that it won't be painful when they put the needle in, because obviously I only had the port put in last week, so it might be a bit sensitive, so they gave me a special cream. I used to have the special cream when I was a teenager, so I feel like a child, but I'm going to take anything I can get that doesn't make things too painful. And yeah, I've got this nice chair. It's like a little bed I'm sitting in, so I get to have this to myself, and I have a friend with me who is keeping me company, which is lovely. Okay, bye. Right, so the port needle is about to go in.
I'm just going to wait for the alcohol just to dry on there because it's a bit shiny.
Okay.
Is that alright? And then
Yeah,
we'll
that's
put the needle in.
Sure.
This should all slowly kind of heal up.
Yeah.
It looks a little bit wet. I think that's because you've had some of the cream on it. So
Yeah.
we'll leave it dry when you leave here today.
Okay.
So it should hopefully just dry up nicely.
It did ooze a bit yesterday,
Did it?
so I put a fresh dressing on it.
Okay.
But
Well, we'll give you some more first. That looks like it's dried. So deep breath in. Sharp stretch. Okay. And then we're going to see if it works. I think you could probably, having a feel of that, you could probably get up to the length that's slightly longer. So that's a 15 millimetre needle.
yeah.
I think a 19 would be fine, or a 20, but let's just make sure it's working. Gives me blood back. Oh, tiny bit of blood there. So I'm just going to give that a flush and then a pull back to make sure it's all working okay.
Okay. I had a port last year, but it never got used.
Oh really?
Yeah, because the chemo wasn't working, so they put it in thinking that I would need to have a lot more chemo, and then they changed tack.
Take a deep breath in. It's giving me blood bank. Just give it another.
I can feel it on the left-hand side, which is really weird.
That's fine. So I suggest the needle size. I'm going to get you to take a picture of the size, so you've always got it on your phone. It's always quite useful then. Is that all right?
Yeah, great. So I'm having my first chemotherapy, GemCarbo, which is a combination of 2 drugs, and I'm just, I had the first one and I had a bit of a weird reaction, so they slowed it down, and now I'm on the second one, and it seems to be going okay. So hopefully home time soon. Bye. Nausea. Blah. I've just done a one-to-one Pilates class because I needed to drag myself out of bed and stop the nausea, but she did make sure that she didn't put me any head down positions to make sure I didn't vom all over her lovely beige carpet. Today I am mainly trying not to vomit. It's hard. There's been a couple of upchuck moments, and I managed to make it to the GP to get another prescription for some more anti-sickness, and then I managed to make it through the waiting procedure at the pharmacist not to be sick. And it's a combination of nausea mixed with just a really horrible saliva in my mouth. It's like oil, and nothing will cut through it. You should see the random bag of things that I've just managed to procure from Tesco. I managed to get some 3 ginger tea thing, some toffee popcorn, some baked beans, and some high baked water crackers. And the idea that hopefully something will cut through, because at the moment my default is breaded chicken and chips, and I can't live on that. So it's not particularly nutritious. I have had some vegetables, but oh boy. If you have any questions about my chemotherapy treatment or the cancer or anything that you think, silly or important, it's fine to ask. Just please ask in the comment section below and I will try and answer them. And please subscribe to my channel so that you can get the latest updates when I post a video. Plus, I will be recording on Tuesday when I have day 8, which is the next bit of chemo for this cycle. Okay, bye-bye.